Good evening, and thank you for joining us for this virtual community town hall addressing COVID-19 in the Fredericksburg region. Mary Washington Healthcare is committed to improving the health of the people in our community. We take this commitment seriously and know the COVID-19 pandemic continues to raise many questions and concerns for you and your family. Tonight, we are here to share what we know about COVID-19 and what we are doing to keep you safe and healthy. During this town hall, you will hear from our expert panel and welcome you to ask questions in the chat during the conversation. Let's meet our panelists. First, we have Dr. Mike McDermott, Chief Executive Officer for Mary Washington Healthcare. Second, we have Eileen Doman, Chief Nursing Officer for Mary Washington Healthcare. And our third panelist is Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer for Mary Washington Healthcare. Dr. McDermott, I'd like to turn it over to you to start the program and tell our viewers the latest information regarding our region.
Well, good evening, everybody. And again, thanks for taking a little bit of time out of your evening to tune in to this Facebook town hall so we can share a little information with everybody about what's going on here in our Fredericksburg region in healthcare and with COVID-19 and some of the impact that we're seeing. And we're under pretty extraordinary pressure right now as a health system. And it's not unique to us just here at Mary Washington Healthcare in Fredericksburg. It's really every healthcare and hospital system throughout the Commonwealth of Virginia, and I'll dare to say throughout the United States of America. If we could bring up our graph. So we currently have 74 patients who are hospitalized that we're caring for who need inpatient hospital care to help them battle COVID-19. And these are record numbers for us. Again, we oftentimes look at this graph and remember the yellow line on the graph is the number of inpatients we have at any point in time, and that we've had at any point in time from March all the way until now. And if you move to November 1st and look at the slope from November 1st until now, this slope that we're on is very, very concerning. Over the past week or so, we were down hovering at about 60 patients at any given day. But just again here over this past week, we have skyrocketed past that, currently have 74 inpatients that we're caring for. By far records for us as a health system. The orange line on the graph, remember, is the number of patients hospitalized in the state. That is skyrocketed above 2,000 patients hospitalized throughout the state of Virginia. The slope of that graph as well from November 1st until now is not a good graph. These are graphs show exponential growth and spread of coronavirus, more prevalence in our communities now than we've ever had. I know we're preaching to the choir a little bit here when we ask everybody to help us spread the word of what needs to happen at this point in time. But now is a time for action, and we need to keep voicing that with you, and need to ask you to keep helping us to spread that word throughout our community. Now is a time for action. We can control the prevalence of COVID-19 in our community. We control it through our interactions with other individuals. And so now is a time more than ever to stay at home and only interact with your daily household unit. Don't have visitors come into your house for any period of time, whether they're infrequent family members that don't spend the night with you and are traveling through town. These are the sort of activities right now that are leading to the high prevalence and spread rates in our communities. Members of families going into other households for periods of the day. Those are very, very dangerous activities. And when you have high prevalence levels like we do now, a certain percentage of those individuals are going to require hospitalization when they have very severe cases of COVID-19. And our health system is under tremendous stress right now, caring for those members in our community that need that level of care.
Thank you, Dr. McDermott. Dr. Newman, can you talk to us a little bit about where we are with vaccinations?
Yeah, so we've vaccinated, we're closing in about 2,000 healthcare workers that we've been able to vaccinate thus far. And we continue to roll out the vaccine through our category 1A, which is really healthcare providers. And we're going to be partnering with the Department of Health to kind of get through our entire healthcare workforce and community. And, we feel good about that. The vaccine, what I get concerned about as this rolls out is that the adoption rate. And I want to make sure that everybody, if you have the opportunity to get vaccinated, when it is your turn, when it's your priority level, please get vaccinated. Even if you're not personally concerned about yourself or your own personal risk, do it because you care about the healthcare system and healthcare workers. Do it because you care about your aunts or your uncle or your grandparents or mother or father. Do it because you care that you want children to go back to school safely. Do it because you want our economy to begin to grow again, business owners and restaurants. There's a multitude of reasons to do it, even if you don't care about your own personal health. This vaccine has been is very safe. And it is very efficacious. It works very well. And in the 2,000 individuals that we've vaccinated here at Mary Washington Healthcare, the side effects are not significant or concerning. People do get some body aches and some chills for a few hours maybe, but it's very self-limited, and that just is your body's mounting immune response. That's not really a adverse reaction. That's a normal reaction that the vaccine is starting to work. We've had no serious adverse outcomes thus far. So please, when it's your turn to get the vaccine, don't wait. Please get it. We need to get out of this pandemic, and it is the hope.
We do know we
Dr.
have more vaccine coming into our community. And so, we're only a few weeks in, and it's hard to know exactly what the logistics are going to look like and what the availability of vaccine and what the volumes are going to be that are coming into our community. But we are aware there's going to be more vaccine coming into our community. And I think it's very difficult to predict when exactly your category will be available to get the vaccine and how quickly that will come about. I know in the category 1Bs, there are other essential workforce, and those individuals age 75 and older are likely to be prioritized. And it's hard to know exactly when we're going to be getting to those groups and have vaccine available in our community for those groups. So be on the lookout. It's hard to, nobody can really predict when that exact date will be when it's available for those other priority groups. It could happen sooner than later.
Thank you. And Eileen, I'd like to talk to you about what's happening in the hospital. Dr. McDermott shared some pretty alarming numbers. So what's happening with our ICU and our staffing? How are we handling it?
Lisa, things are very tenuous, and they really, for the last several weeks, we've always been close to our capacity, particularly in our ICUs. It really changes moment to moment. And it's not just COVID, it is our ICUs are filled with COVID patients, but just as many patients that are non-COVID that are very sick that are in our ICUs, many of them requiring ventilators. And we're not alone. Every hospital from Baltimore to south of Richmond is in the same situation. We know that because we check with them every day. And we hear about this across the whole Commonwealth, and what Mike said earlier, across the country, is that we are really pushing our health system capacity to its limit. At Mary Washington, for example, we launched into plans today to open our third COVID cohort unit, meaning a whole unit that will be, again, limited to COVID. Each of our units are 30 beds. And so now going to a third COVID unit. And so it causes us then to look at moving patients differently and placing patients differently. And it just becomes very tenuous because we're looking at every patient that's coming into our health system and how we can best take care of them. We are taxed. Our staff, the staff is tired. They are seeing their neighbors, their family, their friends actually being admitted to the hospital, wanting to do our very best, but just seeing these COVID numbers grow. And these are numbers that we can control. What Mike talks about, the things we can do, these things work and we have to do them. It's a terrible situation to be in, to be so tenuous that moment to moment, we're looking at our ICUs or any ICU across the state in our region being at capacity. We don't want to be here. And so it really is important for us to do everything we possibly can to control the spread.
I think we've been very transparent. We try to be very transparent with our community throughout the whole COVID pandemic, from back in March all the way till now. And I've really never, I'm not an alarmist, but I've never been more alarmed than I am right now. And it's because, not just because of where we're at with our capacity, with our hospital facilities, but that every other hospital facility in the state is very similar to us. And so I know I've used that analogy before about the orchestra and the violins and the violinists. And so everybody wants to know, well, how many ventilators do you have? It's like, well, that's the violins. What's important are the violinists, the people that know how to use those tools to treat the patients. And you only have so many violinists. And when you hand a violin to somebody that's not a violinist, the music that comes out does not sound the same, right? And so capacities across the Commonwealth, all the violinists are busy, and you can't even find the specialists that you need. At other times of the pandemic, it might have been, very prevalent in New York and maybe not in other areas of the country. People could come to help. You could divert workforce. Right now, everywhere around the country, the prevalence is extremely high. And so there's not that availability to move around specialists or medical providers. Everybody is busy and at their capacities right now. And that's what's very concerning to me. And that's why maybe the actions that I'm telling everybody, they sound dramatic, like do not let anybody else into your home unless they sleep and spend the night in your house. That's your household unit. That's where we're at right now, right? These are the tactics we need to be taking with one another. It's like, no interactions with anybody. Don't go near anybody, right? If you do need to leave your house, you have got to be wearing a mask indoors and outdoors. And I know when I drive in my car and I see people walking outdoors without masks and passing one another on the street, like it's hard not to get exasperated. But we need to implore everybody now, stay at home, right? Stay at home for as long as you can. Do not interact with other humans, even for small periods of time. It's risky. It's just too risky now. And you can see the prevalence numbers of patients that require hospitalized care here in our facilities. They're just like that everywhere throughout the Commonwealth of Virginia. You saw the state graph number 2. These are very concerning times as we head into the new year and look into January. And I know the vaccine does provide some hope, but it's that we're in the middle of a forest fire right now, right? And we need to take action to diminish the flames. And we can do that with our human interactions with one another.
We're getting a lot of questions about that very thing, Dr. McDermott, specific examples. So if we could talk a little bit about it. One of the questions was, how do you know it's safe for people to eat in classrooms, for instance, or in other workplaces? How are we handling, as Mary Washington, encouraging our associates to manage eating and, that some of the things that you have to do with your mask off?
Yeah, we now have a outdoor heated tent so that we can have outdoor dining, which the proper ventilation and a big enough space that we can socially distance. What we found on earlier in the pandemic is that we were not having associates getting sick from patients anymore. We were able to protect them with the appropriate levels of PPE, masks, gear. But when our associates would get into a break room and have lunch together, if one person was sick, they could get the others in that room sick. So we've removed a lot of our furniture from our facilities and our break rooms and otherwise, and we are looking at alternative ways to have people safely be able to eat while they're on the job.
Thank you. And is it I'm going to flip around a little bit back and forth with vaccine questions. And the first one, we have a couple of folks asking about safety of the vaccine, specifically for certain populations like cancer patients or somebody with an autoimmune disease. Like, is it safe if you have something happening in your health?
Yes, and in fact, those are the individuals that we would most want to get the vaccine, and they're going to be higher on the priority list. So if you do have those pre-existing conditions, that's all the more reason to get the vaccine to protect yourself. The areas that it has not been studied yet, we don't know if it's safe or not, pregnant women and children under the age of 16. So that is still, we don't know, it remains to be seen as we begin to study and look at that further. But everybody else, all other adult individuals, please get vaccinated.
And do we know anything more about asymptomatic transmission? Is that still something we should be concerned about, especially in younger or healthy populations that don't express as many symptoms as somebody with more complications?
Yeah, it's one of the great concerns about this. If you were very sick, if you look at the first SARS outbreak 20 years ago, people got very, very ill very, very quickly. So it kind of died out. We weren't able to pass it, but this is spreading like wildfire because most people spread it in the 2 to 3 days before they exhibit symptoms. So in that incubation period, as the virus really starts replicating and building up in your system before you have symptoms. So you may think you're fine and, oh, sure, I can go over to my neighbor's house and it'll be just fine. And that is when you're most infectious. So that's an issue. And then there is asymptomatic spread, or people have very mild symptoms and don't think anything of it, yet they're out in the community and spreading the virus to others, not really knowing. So that is why this has really spread and been so difficult to contain, because of that asymptomatic spread.
And we talk a lot about how to prevent it. We haven't talked much in the last several town halls about what should people be looking for in symptoms. So when you talk about asymptomatic, sometimes they're just so mild that you're not paying attention. What are the symptoms we should be listening to in our bodies?
Yeah, they're basically typical respiratory symptoms. They could be anything from cold symptoms, a stuffy nose, sore throat, mild cough, those kind of things. Some of the classic symptoms that we do see much more frequently is loss of sense of taste and smell. That is a very common symptom, even in those who have mild disease. So if you ever notice that, it's almost pathognomonic at this point for COVID. So, that's a real significant warning sign. And then many people do go on and have fevers and cough and flu-like symptoms, the body aches and those kind of symptoms as well. But many people, particularly children and young people, can be asymptomatic or just have mild cold symptoms.
Okay, thank you. There's some questions here about this new strain that everyone's talking about that came out in the UK and maybe has even shown up here in the United States out west. Do we know anything about this?
We know very little at this point. We do know that it appears to be much more transmissible, so it's much more contagious. It transmits more readily than the first strains of COVID. It does not appear to be any more severe than the first strains of COVID. And the vaccine, from what we're hearing, is the vaccine does work against both strains, which is good news.
Definitely good news.
That increase in transmissibility, though, is very, very concerning. And when you run the math on something that spreads exponentially, like COVID-19 does, the increase in transmissibility is way more severe than an increase in even like fatality rate by 50%. If it spreads by 50% more, the impact and the number of people that will actually possibly die from the disease is significantly more. And so that transmissibility increase is very, very concerning. It's another reason why there's a call to action now, which is you have to almost assume every other single human who's out there in the environment you're around, when you look at them, whether you know them or not, assume they have COVID-19. And so you'd rather not be around them, not be in their environment. Do not let them in your house or any indoor space. Limit those activities at this point in time. You should not be eating out at restaurants right now. That is one of the most dangerous activities I think you could actually do. I will just say that it's like sharing a meal in an indoor restaurant right now with other strangers is, I think, extraordinarily dangerous at this point in time.
Thank you. And, we've even heard comments on our social media many times that this is just the flu, isn't it? Isn't the flu a coronavirus? Can we talk a little bit about the difference between flu and what we're seeing with COVID-19?
Yeah, they're very, very different viruses. So the influenza is not, coronavirus. So COVID is much more contagious. So the standard COVID, the first strains, at least 3 times more contagious than influenza, much more deadly than the seasonal flu. There have been pandemic flus, such as the flu in 1918, that was also very, very deadly. But the typical seasonal flu is nowhere near as deadly as COVID is. We've had over 300,000 Americans die thus far, and it hasn't even been a year. That's 1 out of every 1,000 Americans has died from COVID in the last really 7-8 months. That's just an astounding statistic. And we have thousands of Americans dying each day as we go forward. And as the prevalence is really exploding over the next couple months, I think we're going to see very dark days with the numbers of deaths and fatality. And it is true that most of the individuals that do die from COVID are usually over the age of 65. So the vast majority of that 300,000 are. But there are over 20,000 Americans that have died from COVID who are in their 30s and 40s. So that's an astounding number, really, from people who are really at the early part of their lives and in vital health and still dying. So it's nowhere near what influenza is. It's no comparison.
Thank you. And we've heard that flu cases are down, yet COVID cases are up. So how does that work? What happens that we're seeing this when everybody thinks the masks are getting rid of the flu season, but the masks aren't getting rid of COVID?
Well, COVID is, as I said before, is 3 times more contagious as influenza. So I think a lot of the parameters that we're taking, the masking, the social distancing that we're doing for COVID is really preventing the spread of influenza. Also, we've seen an uptick in people getting the flu shot because of the pandemic. So I think that has really helped to play a role of protecting us as well. And I do think a lot of the COVID is being spread right now in household gatherings, family gatherings, people visiting friends. That is where we're seeing the vast majority of spread at this point. I think people are being safe. I see pretty much everybody's wearing masks when you're out and about, and that is great. But then they let down their guard and go over to a neighbor's house or go to a party or birthday party or Christmas gathering, and that's where the spread is occurring.
Yeah, thank you. And we still have community members who watch and tune in every week with us who are sharing the message, and they're worried that there are a lot of people who still don't think this is real. So what can they say? What could they share with their friends and family and even their professional networks to make it real for everyone?
Well, I mean, they could share the link to our Facebook town hall, right, and look at some of the data and the graphs of the prevalence of what's occurring throughout the state. There's lots of data out there on the Virginia Department of Health website, the Virginia Hospital and Healthcare Association website. Like if people are data driven, show them the data and what's actually occurring. It is a time for alarm. Like I said, we have to be sounding the alarm right now. As we look in the forecast ahead with the pressure, the entire Virginia healthcare system and the entire healthcare system in the United States of America is under, the pressure we're under right now. And we cannot afford any increased prevalence of COVID-19 right now. And unfortunately, with all the trajectories we're seeing, it looks like that's what's ahead. That's what's so dire. And now is a time for action. We just need to keep raising the alarm. And I know we're a little bit preaching to the choir with everybody who's tuning into these town halls, but we need to implore you to keep spreading the outreach. If you didn't talk to 5 neighbors and friends last week, please pledge to do it this week. Try and spread the word to 5, 10 individuals if you can, that, hey, things are, the situation looks dire out there. We can all take action here over the next coming weeks to help diminish the prevalence in the spread of coronavirus in our community. We can do it. It's within our capacity to do that.
Thank you. And as these number of cases continue to grow, is Mary Washington Healthcare going to have to make some tough decisions on canceling specific procedures or surgeries?
We're already there. We are looking at individual cases and seeing what can safely be delayed and what can't. Most surgeries where you don't require a hospital stay, we're able to proceed with those. But anything that is going to utilize hospital and particularly ICU resources is problematic when it's scheduled. Of course, those are the surgeries that are the least likely to be safely delayed. That is the concern. These are often heart procedures, cancer surgeries, and we're put in this tough situation now where we can't care for people who have other conditions, or we're having to be very careful about who we can postpone a procedure for and who we can't. And that's why we're imploring our community to flatten this curve so that we can care for everyone. And as Dr. McDermott had previously said, Normally when a hospital is busy or, at capacity, you can send somebody to the neighboring health system. But that's not the case. There's nowhere to go. All the health systems are tapped out. And this is not about beds. It's not about field hospitals. It's not about ventilators. This is about the highly skilled personnel that that you require to take care of people who are that sick. We cannot create ICU nurses in a week or two. You cannot train somebody with that level of skill quickly. Our ICU doctors, our respiratory therapists, our physician assistants, and nurse practitioners who work in these ICUs, highly skilled, years and years of training to be able to do that level of care. And we just, it's the personnel that we don't have anymore.
Thank you. How safe is it to be near somebody who's been diagnosed with COVID-19 a week after, 2 weeks after, 4 weeks after? If you have somebody in your household who has had it, what kind of precautions do you have to be thinking about?
You have to be very careful. Masking then in the house, which is not a fun or a comfortable thing to do, not something you want to do, but you have to have extraordinarily strict masking. You should not be sleeping in the same room with that person if you're their spouse or a sibling or something. You really do need to isolate and that individual within your house, or you or the people who are well need to isolate. There does have to be that kind of separation for at least 10 days from the point of diagnosis and when the person's asymptomatic and afebrile. So that's when you know it's safe. You do not need to get a repeat test. People's tests can stay positive for weeks to months after COVID. So it's really 10 days and you're well, that we know that it's safe to be around them again.
Thank you. We're getting some more vaccine questions too, of mentioning that we're nearing the 2,000 mark on our vaccines and already administered to this phase 1A group. It's a tiered system that can be very confusing to the general public. Do we have vaccines to continue the work of those 1A groups and into the 1Bs and the 1Cs?
Yeah, we do have vaccine. We're getting some more, and the Department of Health is getting some. So really, we are trying to ramp this up as quickly as possible. Our mission is the health of this community, and it's hard to think of something more important than the vaccination of our community at this point. So the vaccines do no good sitting in these freezers. They only do good when they've been deployed and administered to individuals to protect them. So we're trying to protect our healthcare workforce, and then we'll be as rapidly as possible trying to get into essential workers, those over the age of 75, then those over 65 and pre-existing conditions, and then the broader community.
It's important to say that's the mindset we have as we start to roll into this vaccination effort. We all have the mindset that the vaccines don't do any good sitting in the freezer. And we have the prioritization groups, and we're trying to work through those prioritization groups because they make sense. And so it's a matter of following the prioritization groups and working as quickly as we can to get as many members of our community vaccinated as quickly as possible. We're committed to that.
Great. And one of our community members have mentioned that they've heard that it's important to get treatment early when you have been diagnosed with COVID. So what kinds of protocols or treatments are we using here at Mary Washington Healthcare to prevent hospitalization?
So the treatment's important to get early if you're at somebody who has at higher risk. So if you are somebody who is not at a high risk, the most important thing for you to do is stay away from others. Isolate yourself and don't get anybody else sick when you've been diagnosed with COVID. But if you're over age of 65, you have certain pre-existing conditions, certain children who have immunocompromised systems and others, there are now the monoclonal antibody treatments available. And they need to be given early, and they prevent people from going on to become very ill and need hospitalization, need an oxygen requirement, and those kind of things. I'm pleased to say that we're closing in on about 100 people in the community that we've now been able to treat in the last couple of weeks with the monoclonal antibodies. And we're working very, very hard to get the word out that there is this treatment available for individuals who are at risk for developing more severe COVID.
Thank you. Now, a question about contracting COVID-19. If you've had it before and recovered, can you get it again, or could you get this new strain that everyone's talking about?
There have been reported cases. You have to remember, we've only been in this for a few months. It may seem like it's been years, but it's only been a few months. So there are definitive reported cases of people getting COVID more than once. So that it is a possibility. When they've looked at following antibodies in individuals who've had it, about 80% of people have a significant antibody response about 6 months later, but 20% don't. So it's and it's unclear, how protective, if you've had COVID, it will be, from you getting it again. It is recommended that you should get the vaccine even if you've had COVID. So just because you've had COVID does not mean you should not get the vaccine, because the vaccine's felt to give additional protection from getting it again.
Thank you. We are getting a lot of questions about schools. I know we don't typically talk about how other businesses or organizations or community partners conduct the way they do things, but there are questions that maybe we can give our perspective. One of the questions was, if we have 300 people in a school, how can we be safe? Now, we have several hundred people come to work every day at Mary Washington Healthcare, and we have found ways to keep them safe. Are there ways for people to continue to be in certain jobs, like in the schools, and remain safe from spreading COVID?
Yeah, it's the same things that we do here at the hospital, masking and social distancing and avoiding eating together, unmasked in close proximity, ventilation. There's a lot of different things you need to look at about, the safety. And there's never a zero risk situation, unfortunately. I wish I could say there's a zero risk. Zero risk is you being isolated completely by yourself, away from others. And many of us don't have that ability. We're essential workers or schools and others. So children are lower risk. They're not no risk, but they're lower risk of getting significantly ill and appears to be transmitting, but they can transmit to adults. They can transmit to the staff. Many of the schools, and I've had the pleasure of working with some of the schools locally, they're really putting in very rigorous efforts to keep people safe. But it's the same concepts we're talking about. It's social distancing, it's universal masking, and avoiding the high risk kind of activities.
And you made mention to this a little bit earlier in one of your comments, but maybe we could talk about it, of transmission to our own staff. What are we seeing for those of our staff who are getting COVID-19? Are they getting it at work, or are they getting it outside of work?
By and large, most of them have been community exposures of late. It's been quite a while since we've had an associate who has acquired COVID related to work. And so it is community acquired. And I think that's because that at work we have really reinforced the things that we've talked about: the masking, the social distancing, the hand hygiene is just so important. And then also, when our staff are taking care of COVID positive patients, the amount of PPE that we're using and the practicing that people are doing as far as the donning and doffing and being very careful about what they're doing when they're with COVID positive patients, and balancing that with the isolation of a COVID positive patient being in the hospital alone, and wanting to be able to provide that emotional support as well. But our staff have done an excellent job of that, and that's demonstrated by the very small number of associates we have seen that have contracted COVID at work from a patient. But it is very concerning when we see the number that are contracting it because of community acquired.
Sure. And that's not practicing that same vigilance outside of the workplace.
Mm-hmm.
Mm-hmm. So is it safe if somebody has a COVID positive family member, like say if one of my kids or my spouse has COVID, is it safe for me to come to work?
Yeah, you really should be, for most jobs, it's recommended that you have a 14-day quarantine. That quarantine can be shortened, The CDC now has guidelines that if you get tested at day 5 from your exposure, you can release the quarantine at 7 days. So we are starting to shorten that period of quarantine. But unless you're an essential worker, really recommend that you're quarantined for probably that 7 days if you're able to test on day 5.
Thank you. And could somebody explain what COVID pneumonia is? It's one of the questions we got.
Pneumonia is just really sort of an inflammation and infection of the lungs. So, the virus does, it infects and infiltrates a lot of the mucosa and a lot of the respiratory organs in the body, including the lungs. And when the lungs get inflamed, and they can actually fill with like pus, essentially, and then it prevents your lungs from being able to exchange oxygen and get oxygen into your blood. And that's where the oxygen levels drop very critically low, and becomes difficult for people to breathe. And sometimes they need ventilators to really support individuals through that. But the lungs, it's more than just the lungs being inflamed, it's the layers of the lungs. There's something called ARDS that occurs, which the layers of the lungs get sort of thickened and scarred and inflamed, and prevent the oxygen being from able to get into the blood and oxygenate the body. A little technical probably for this group, but pneumonia is just essentially inflammation and infection in the lungs.
Thank you. Can we talk a little about vaccine safety, specifically for someone who maybe has had allergic reactions to drugs or bee stings or something like that in the past? Should the vaccine be given in a hospital or a medical setting because of that?
Yeah, so we've been talking about this a lot. There have been a handful of severe allergic reactions to the vaccine. When we look at hundreds of thousands of people across the world now that have been getting the vaccine over the last couple weeks, it's really just a couple individuals that have had these very severe allergic reactions. And these are individuals who have a prior history of a life-threatening allergic reaction. And those are people that have had something called anaphylaxis, which is a life-threatening allergic reaction to something. And they usually have to carry what's called an EpiPen, for those kind of emergent situations. I do think the press is, every one of these they'll jump on and you see reported. But when you look at anything that in healthcare or that you put in your body, this is much more safe. The incidence of a severe or an adverse reaction with these vaccines is exceptionally low. So we're very lucky that these vaccines are so safe and work so well. So if you have a prior history of anaphylaxis, I'd be concerned to be monitored.
Yeah, but even of all the people who've had anaphylaxis in the past, most of them probably won't have a reaction to this vaccine that causes anaphylaxis. And just a matter of perspective, like Chris said, there's probably now millions of doses that have been administered across the world, and we're talking about a handful of cases, very small. And you take a medication that we have like penicillin, which is still in very common use around 1 in 2,000 individuals will have a serious reaction to penicillin. That's 1 in 2,000. And we still use that drug very often, and people don't think twice when they get penicillin about taking it. And so, this idea or what you see in the news about these reactions, they're extraordinarily rare, like a lightning strike sort of thing, or even rarer than that, probably. So really nothing to be concerned about. And all of those individuals had a history of having had anaphylactic reactions before. The safety profiles on these vaccines are extraordinarily safe. We're very fortunate with how they've come to be and the science behind them. Very safe, extraordinarily safe safety profiles, and very efficacious at preventing severe COVID-19. So very effective, very safe. We're all very fortunate to have these vaccines available to us with the safety profiles that they have.
Thank you. And if somebody does have COVID-19 at home and are well enough to care for themselves at home, but still feel unwell, what advice do we have for somebody to treat themselves at home? They've heard about, lying on your stomach, walking around, lots of fluids or any kind of medications to have on hand? How could someone be prepared to potentially convalesce at home?
It's really just supportive care for the most part. So that's fluids and rest, ibuprofen and Tylenol for some of the symptoms. Some of the things that have shown some preliminary data to help shorten or improve the course is also vitamin D, vitamin C, and zinc have all recently been shown to have some efficacy. So those are all over the counter. So you could take vitamin D, vitamin C, and zinc to help with your immune system as you battle the COVID.
If you're going to have a limited case of COVID-19 at home, it's really like you treat any other viral disease that you might have had in the past. You know, it's the same sort of self-care as you work through, as the virus works its way through your system at home, hopefully in a self-limited way where you don't require a hospital level care due to low oxygen levels or the other sort of things that a very certain percentage of patients who come down with COVID-19 do require, unfortunately. And so that's why you need to stay safe and not get COVID-19. You don't want to be rolling that dice. You might be one of those individuals that doesn't have the self-limited case, and it's not worth getting COVID-19.
Yeah, one of the questions was even, should I consider having a pulse oximeter at home to see my oxygen levels if I were to have COVID-19?
It's not a bad thing to have. I don't know that it's really necessary, but it's not a bad thing. I do know that a lot of the reports are people, the oxygen level drops so slowly that it is often imperceptible symptomatically for the person until the levels get critically low. So if you're able to get a pulse oximeter and you're able to follow that and understand it, that is something that you can follow. And certainly if your oxygen saturation gets below 90%, that's when you really want to be getting evaluated.
Thank you. Some more technical questions. Does Mary Washington Healthcare do any sort of surveillance testing in the hospital to monitor potential positive cases?
So we are not testing everybody coming in. We are testing people for high risk surgical procedures. So those individuals are being tested. And then everybody else is being tested if there's a suspicion that they could have COVID, or if they're coming from a congregate living setting, such as a nursing home or a student living in a dorm room or somebody in prison, where there's a lot of people in close proximity to each other, that's a risk as well. So we are testing those individuals as well.
Okay. And one of the questions is, how do we manage ventilation at Mary Washington and Stafford hospitals to keep our patients and employees safe and prevent transmission?
Mike's talked about that a number of times. Just because we're a hospital, the way that we approach ventilation is different than a usual commercial building or a retail building. And so, we monitor things like how long it takes for air to exchange in particular areas of the hospital. So in our operating rooms, there's things that we are monitoring all the time around the air that's in those rooms. In our patient rooms, there's rooms that we have that we monitor that airflow. We've got a filtration system throughout the whole hospital that is hospital grade. It's not the kind of thing that you see in commercial buildings or retail buildings or homes. So those things are part of our norm. That's just our environment, because we're always ready or prepared that there could be something that comes into our building that we have to protect the people in our building, just because of the nature of what we do here. And so a hospital is always going to be different than what you would see in commercial or retail or a home setting. It's just part of the hospital environment.
Thank you. Some more questions about vaccine. Where can the public access information about which groups and tiers of the vaccine are available and when?
I do know the Virginia Department of Health is working through the state right now to finalize the priority groups outside of the 1A group that was initiated. And so the 1B and the 1C group, I think they're working on finalizing those now. And I'm sure as those groups get finalized that they'll be put up on the Virginia Department of Health website. And like I said, I don't think it's one of the things I would I would stay aware of who is currently being vaccinated and what priority groups in your region of the state. I don't know if that's going to work absolutely in sync throughout the entire state the same way. So I would just encourage everybody to stay aware as to what priority groups are currently being vaccinated in your region. And if you're in one of those priority groups, please get vaccinated for your safety and to help decrease the prevalence of COVID-19 in our community.
And you can find some of that information on the Rappahannock Area Health District's website, which is part of the Virginia Department of Health. They do have some information on a COVID vaccination page. Again, it's preliminary because we are in phase 1A, which includes healthcare and EMS workers and long-term care facilities. Another question we had was, should someone wait any period of time after receiving the vaccine before doing something like having a surgery or other test?
There's no formal recommendations as far as that. Most of, we've been monitoring the symptoms of our associates, and the most common thing that we're seeing is about 12 hours later, people may have a few hours of aches or chills, really as your body, mounts that immune response. But it's generally very self-limited. You may not want to do something, schedule a procedure or something the day after, but in general, there's no formal recommendations as what you can or can't do after receiving the vaccine. It's very safe.
And can you remind our viewers, Dr. Newman, how long it takes to build immunity with these vaccines?
Yeah, so with the Pfizer vaccine, the first dose is given, and then a second dose is given at day 21. And then 7 days later is from that. So at day 28 from your first dose is when you were felt to be immune. Moderna is just about a week off from that. So the second dose is given at day 28. So it's just slightly different on how they developed and studied their vaccine.
Thank you. We do have a question. Do hospitals get government funds for every positive COVID test that we get?
For every positive COVID test, no. There's no funds for COVID tests. For some of the inpatients that are hospitalized that have COVID-19, there's a reimbursement rate for caring for those individuals because the insurance companies and the federal government have recognized that the length of time that they're in the hospital far extends other typical patients. And so I will say, I know we've heard these rumors before if this is somehow a financial windfall for hospitals. COVID-19 is not a financial windfall for hospitals. And I think I can safely say that the reimbursement that comes in for the care for the patients does not cover the actual costs that are needed to care for those patients over the length of the time that they're in our hospital system. And that's one of the weird things about the reimbursement systems of hospitals and the case rates that we get for patients that come under our care. But the reimbursement that we get for COVID-19 patients does not come close to meeting the level of resources that are used in providing the care to those patients. So it is not in any way a financial windfall for hospitals. Here we are, members of the healthcare system, imploring everybody in our community to take steps now to limit the number of COVID-19 patients that are in our facility. In no way is it a financial windfall or are we motivated in some way to have it be any other way. Like, for the safety of everybody, now is a time to take action. We need to flatten those curves.
What we're talking about is not having enough room in our hospitals to take care of any more patients. And so we're so beyond, what the question of sort of, is there a financial windfall? There is no financial windfall. When a COVID patient comes into the hospital, if they're sick enough to be in our ICU and they're sick enough to be on a ventilator, they're here for at least 3 weeks. The amount of time and just the level of illness. And for us to be at a place to be able to say, we have no more room. It's day to day. We're asking you very basically, please don't get sick and don't get others sick, because we want to make sure that we have the capacity to take care of the people in our community that need us. And that capacity is being pushed. It's extremely tenuous.
Yeah, it's usually a great privilege for us to take care of you when you have a healthcare need or you're sick, and it's our pleasure to do that. That's what we're here for. This is a time, and I can't think of another time where we've asked you to not be a patient. Please stay well. Do not get COVID. We're not looking for more COVID patients. This is not a financial windfall, and it is really taxing the entire health system in our country. We're concerned, the entire healthcare community is concerned that we're not going to be able to keep up with this demand and care for everyone safely.
You asked earlier, Lisa, one of the questions was, what could somebody say, to others who aren't taking this seriously about, or who could they talk to? Talk to healthcare workers that are working in our hospitals. Ask them what it's like that every day when we're having to look at taking care of more patients than what they usually do, or the decisions and the way that they're providing care, the things we're asking nurses and respiratory therapists and other clinicians to do just so we can have the capacity of taking care of everyone that's here. Those are the people that are experiencing what this is like on a day-to-day basis, and knowing that they're caring for their own neighbors, their own family members, they've lost family members. Talk to a healthcare worker that's living through this every day if you don't think that this is real.
Yeah, and speaking of capacity, one of the questions that came in, or not even capacity, but the numbers, clearly the numbers are going up. Does that mean that we're also seeing an increase in deaths in our area?
We are definitely. There's a certain percentage that will not, have a successful outcome with their battle with COVID. So, we're seeing thousands of people across the country die every day from COVID. It's heartbreaking. We're looking at these numbers as if they're just numbers, but these are individuals. These are loved ones. These are members of our community that are succumbing to this. So it's very sad.
Should people be worried about getting that second dose of the vaccine? Is it imperative to get the booster?
The recommendation is to get the booster to be able to protect yourself. That's how these vaccines have been studied. That's how you get the most rigorous immune response. There may be some protection from just the one vaccine. I suspect that there is, but please get the both doses and get the full protection, that 94% level of protection against COVID.
So we did just get asked, are we being asked to avoid the school questions? I do tend to avoid asking you guys the school questions. So that's me. That's not anybody asking. We're here to talk about what we're doing at Mary Washington Healthcare, not necessarily what somebody else is doing. So maybe Dr. McDermott, if you could address that I am avoiding asking all of the school questions, because I'd say 75% of the questions coming through today are school questions.
I'm going to share my opinion, and because it's real and it's how I feel, and it's not much different from everything else that I've said today when I'm imploring everybody to stay in your household units and limit the amount of time that you're around others. And I'll just say, when you're in a situation with prevalence being as high as it is now in our community, throughout the state, throughout the nation, right? And when you see the pressure on the healthcare system and hospitalizations that you're seeing, not just here locally, but throughout the state and throughout the nation, I don't know how you look at an environment like going back to in-person school at this point in time responsibly. I don't know how you do that. And that's my opinion on it. And I say that because, looking at the situation that we have and following the actual facts in the course, in the prevalence and our hospitalizations and everything else that's going on right now, it's never been a worse time, right? And if schools were considering not going back in the fall when the prevalence was much less, how do you do it right now when the prevalence is higher than it's ever been and the number of patients hospitalized is higher than it's ever been and the number of patients dying from COVID every day in our country is higher than it's ever been?
Thank you, Dr. McDermott. So with that, we're going to close. If there's anything, Dr. Newman, if you'd like to add anything before we start to close out.
No, I just want to continue to trumpet my enthusiasm for this vaccine. And really, even if I find a lot of people on the fence as we're talking to individuals and we see surveys in the communities about, well, I'm probably not one of those risk categories, so I'll just forego the vaccine. But don't just think about yourself. Do it for somebody else. Do it for our economy. Do it for your neighbors, your community, for schools. When it's your chance to get the vaccine, please do not delay. Get it. It is our way out of all of this.
Thank you. And Dr. McDermott, closing remarks?
My closing remarks are just going to go back to the graphs we looked at earlier and the curve that we're on and the slope of those curves and the prevalence, right? And so again, it's me imploring everybody who's tuned in today to now is the time to take action to help us flatten the curve. And I appreciate everybody helping us spread the word there. And then just my final word is to all the members of our healthcare team here at Mary Washington Healthcare. Thank you for everything that you're doing under these trying times to help make our community healthier. So inspired by everybody and what's happening here every single day under this time of tremendous pressure.
Thank you. And speaking of that, Eileen, we had in the paper just this morning that our call for gratitude for our associates who are struggling 9 months into this. They continue to be fatigued. You mentioned it earlier in our talk. What can our community do to show their gratitude to the frontline workers who are facing this day in and day out?
So they can do a lot of things, and our healthcare workers need a boost. They need to know, early in COVID, it was wanting to make sure that healthcare workers knew that they were appreciated, they were loved. We need that again. Because this has been a long haul and they are tired. And so the small signs of generosity and kindness, of saying something nice, but the signs outside the parking garages, the chalk markings on the parking lots or in our entrances, the beeping of the horns when you drive by, the parades, any way of recognizing healthcare workers is greatly appreciated because they need that boost. And for those of you in the community that have the ability to make donations, one of the things I think about often is, how after working a 12, 14-hour day and then having to go home and deal with, a dinner, meal for your family is, wouldn't it be nice if we could say to some of our healthcare workers, tonight dinner's on our community, and take care of your family, and here's a gift card, just a variety of different ways. So you see the website that's there. If you are inclined and if you have the ability to make a donation, we would greatly appreciate it. And in general, if you've got a way that you can just say thank you to the healthcare workers, the great people that are here that are part of Mary Washington Healthcare, they are tireless and they are so committed to taking care of our community, and we have stressed them, we have pushed them hard. And so please join with me in saying thank you to all of them. And I'd like to close tonight by sharing with you a little bit of them saying thank you to you.
This COVID pandemic has stretched us to be outside of our comfort zone, to take on new things and also just learn from it, but also the caring piece of it. I mean, we really, as an organization, care for our patients, but we also really care for each other.
Something that I've really learned in particular is really just kind of appreciating what you have and just living in the moment. And, it might seem like we can't get it done or it's not going to happen, but, if you take a deep breath, you really think about the patient in this case, it'll get done. We'll take care of the patients like we need to.
Respiratory department, both here and the other places I've worked in the past, we've always worked as a team, but I just felt like during this period, the teamwork has increased even tremendously. Having that atmosphere to be able to share your fears and thoughts, because believe it or not, a lot of us, including myself, we were scared.
We're all going through the ups and the downs. There's the ups of knowing that we're on the front edge of this. We are learning everything as fast as we can. We're taking care of those patients and we're sending them home most of the time feeling great, or working towards feeling great. But then there's the patients that COVID has taken over.
The ICU is a group of amazing nurses. They take the best care of every patient every day, and during this time that was no different, making a difference in these patients' lives through the challenges, holding patients' hands while they're dying without their families there. That compassion truly came out, and providing the excellent care to those patients.
As nurses, we give back. So that's what we get. When you give back to your community, when you see families being able to get back together and go home and to have things move forward, when you have staff that are volunteering left and right, they want to work by your side. As a leader, we're by their side. So I was very happy and am very happy to be part of this journey.
With that, I'd like to thank our panelists for helping out this evening and educating our community on what's happening here at Mary Washington Healthcare, and a great shout out to all of our frontline workers who you saw just a few of those that are going through this every day. And thank you to all of you for tuning in to our town hall this evening. Remember, if you have symptoms and you're not sure where to seek care, our HealthLink triage nurse is available to you 6 a.m. to midnight every day. With the number there on your screen, 741-1000. There also are continuing to be free testing, COVID-19 testing through the Rappahannock Area Health District. They've released their January dates, so continue to seek the free testing if you are experiencing symptoms and need to be tested. You can visit their website on our screen to register for one of those testing sites. Mary Washington Healthcare will be continuing to host this town hall series next month. We will start our January series on Thursday, January 7th at 6:30, where you can hear from our panelists on the latest information as we enter the new year. And as we continue through this holiday season, we ask that you please, again, stay safe and healthy with your household, and have a good night. Thank you.